Welcome to the Sharing Without Shame podcast, dedicated to parents and anyone else who loves someone in active addiction. Education is a powerful tool in breaking down stigma, fostering understanding, and ultimately helping individuals and their loved ones navigate the challenges of addiction. With Donna Marston, author of Peeling the Onion and Sharing Without Shame. So take a deep breath and grab some tissues as we uncover the stories of love, courage, and unwavering support in the face of adversity, as Donna and her guests share their stories without shame. Because when we share our stories without shame, we inspire others to do the same.
Hello and welcome to Sharing Without Shame podcast. I'm your host, Donna Marston. Today's podcast is sponsored by Snap Bands, and this is my band that I wear, and it has blessings. And when I received it, I never thought of myself as a blessing, and that's one of the things the packaging says. It's cognitive therapy, and you just give it a little snap if you're having a craving or you're just having some bad thoughts, and it will snap you right out of it. If you'd like to order one, you go to snapbands.com. That's SNAPPBANDZ.com. And in comments, just write SWOS or Sharing Without Shame so that they'll know that you heard it from me. So today, my guest is Laura Ellick, who is a licensed psychologist in New York, Florida, and Virginia. She is a speaker, a life coach, and a business consultant who has been featured on TV, video channels, and she specializes in eating disorders, addiction, and chronic medical conditions. She's a passionate educator, speaker, and the author of Total Wellness for Mummies and Wisdom from the Universe. So welcome, Laura.
Thank you so much. I'm so glad to be here.
Thank you. First question I always ask, what would you like to share without shame?
Ooh, that's a tough one. And I want to make it G-rated for sure, because we don't want to offend anybody. No, really just thinking about it. I've been in the mental health field for over 20 years, having a significant amount of experience with eating disorders and addiction. And I think, one of the things that looking back on it now, I can say, oh, well, I was young and I didn't know any better. But I was, pretty judgy when I was younger about people who may be struggling with addiction, really taking the stance that I hear a lot of family members take, kind of like, well, why can't they just stop? Or I don't understand. Don't they see that they're ruining their life and everybody's life around them? And so really, if I were to go back and say those things out loud, now I would be completely ashamed to hear myself verbalize those things, knowing what I know. But I will give myself a little bit of grace for being young, but it also shows to me and helps me be a more responsive clinician that these are the things that do go through people's heads, and we can't believe that it's not there.
Right. Well, and I think too, some of it is the era of what was going on, back in the day when my son was in active addiction. It was in the 90s and early 2000s. You didn't talk about it. And to be honest, I had the same thought process as you. Why can't he just stop? If he loved us, he would just stop.
Mm-hmm. And I love how it's phrased. He would just stop, as if maybe he hasn't already tried to just stop 5,000 times before.
So tell me about how you're versed on addiction. How do you work with people?
So one of the things that I think is really interesting, looking at the history and the context of addiction, is when I was growing up, in the 80s, right? It was just say no, right? And that would keep us safe. All you had to do was say no. So I wish it were that easy, right? And in the experiences that I had when I was growing up, I was able to just say no. I was surrounded by people who maybe were experimenting or who were using or who were doing whatever. I didn't feel that same pressure. I was focused on the things that I wanted to do in life, and it was incompatible with doing things that might have a permanent impact on my brain.
Donna Marston knows what it's like to face the heartbreak of having a child in active addiction. She found a way out of that suffering and is now dedicated to helping parents navigate their painful journey with compassion and clarity. Donna provides a safe and supportive space for parents to share your feelings, gain insight, and learn how to prioritize your well-being. Through personalized wellness plans, she'll teach you how to establish healthy boundaries, break free from enabling behaviors, and develop better coping skills to foster a healthier relationship with your addicted teen or adult child. As a coach, author, and advocate, Donna combines her personal experience with tailored strategies to guide families toward hope and healing. Every new client receives a complimentary copy of her book, Sharing Without Shame, which is filled with inspiring stories of resilience. If you're ready to take the first step toward healing your heart and reclaiming your life, visit www.SharingWithoutShame.com to book a session with Donna today.
Not too many people are thinking that far ahead
Right.
when they're 15, 16, 17 years old. As I got more and more into the field of psychology, I had been working with the really seriously mentally ill. People who are schizophrenic, who are paranoid, have a really hard time putting a thought together. And so when I first had the opportunity to work with another type of group, it was people who were struggling with addiction. And at first, maybe this is another thing I should say with some shame, I was just happy that there were people who could converse with me. Like we could actually sit down and do some kind of therapy because they were present. They struggled, they had issues, but it was very different from trying to have a therapy session with a schizophrenic who is clearly not there. But what I learned was I had so much to learn. And the industry and the field has come so far, and things go in vogue and then they go out of vogue, and there's harm reduction and then there's not harm reduction. And I still see that division in the field. So I started at a time where it was detox, AA, methadone clinics, very much like needle exchange programs were controversial. I think they still
Yeah.
are in a lot of ways, but it was limited. Treatment was limited. Insurance said you needed to be done by 28 days. There's no reason why you shouldn't be completely clean and sober by 28 days, and you should be able to be on your way and just go to AA, and families go to Al-Anon, and everything will be okay. And of course, as you know, and as I know, the field has just exploded in a different direction, and it's way more complicated than we ever would have thought.
I remember because my son used in those, he found his recovery in '08, I think it was. And that thought process, because that's what insurance companies told you, right? 28 days. So I had it in my head. He's going to get well in 28 days. He just needs to go to treatment, listen to what they say, do what they say, and everything will be okay. You come home. We don't have to talk about it. We can keep our secret, and we just move forward and live our lives happily ever after. Wrong. It doesn't work that way. And every time you had a reoccurrence, I took it personally. But one of the things I noticed, and I think that this topic I want to bring up, well, there's two topics, is anybody can do this, but I wonder if it's more prevalent with people in active addiction, gaslighting. Because I know there were times I felt like I was crazy out of my mind because he would say one thing and then tell me another thing. He would tell me, if I'm doing this, it means I've been using again. And then when he would do it, I would say it to him and he'd be like, what are you, out of your mind? I never said that. Can you talk about gaslighting with people who are in active addiction?
That is a great question. I think, the term gaslighting is also controversial now because, anytime that somebody is lying, we call it gaslighting. Sometimes it is, sometimes it isn't. We do know that people who struggle with addiction do tend to have some of the personality characteristics of narcissists right? And narcissistic personality disorder, and they are the kings and queens of gaslighting. However, we also know that, look, anybody who has any kind of addiction, any kind of problem, whether it's an eating disorder, whether it's a drug addiction, whether it's gambling, you will do anything to protect the addiction. So even if that means lying, right? They'll lie. Now, is it necessarily gaslighting? Depends. Gaslighting is specific to narcissists. Is there lying? Absolutely. And the goal is a couple things. Originally the goal that I thought was these people were just liars and just wanted to get back to doing what they were doing. It was much later that I also recognized, listen, there's also a lot of shame underneath, and the lying is to protect the ego, right? And to protect even the family members, but every time that someone lies, they feel even worse about themselves. And they get more and more entrenched. So I think the lie originally starts off, let me just protect the addiction. I don't want anyone to know what's going on. And then as the lies build, I think it's more to reduce the shame and the embarrassment, especially I've seen with people who've been in treatment on more than one occasion. I don't want to disappoint anyone. Everybody else has worked so hard for me. I can't imagine having to tell them that I screwed up again, even though we know it's not a screw up. So I think there's a lot that goes into it. And yes, there is that group of people who are just sociopathic, who just lie for the sake of lying. And it's there, but not
Yeah. Well, and I think too, lying can be part of the denial, right? And there's two types of denial, that they know they have a problem, but they're not going to let us know, right? Or they're really in denial and they're lying to themselves.
That's the scariest one too, and I see that in both, traditional addiction and in eating disorders where the evidence is there. How can you not see it? But if they saw it, they would have to do something about it, and they're stuck.
Yeah. And you know what? Parents are in denial too. I was in denial. People would tell me that, things about my son, and it's like, not my child. He wouldn't do that. We brought him up, teaching him about drugs and alcohol, and, he was educated about it. But what people don't understand, and the way I describe it, and actually I think it's in my first book, is that we're all born with like this little tiger cub in our gut, and it's asleep. Some people who have or are prone to addiction, it might be in their DNA or whatever it is, could be that they're on a med and it changes their brain chemistry. But I'm going to use my son because I really believe it was in his DNA, is that this tiger cub's there and it's asleep, and he's like 15 and he's starting to use a little cannabis, right? And so here he is, and it starts to wake up, and then he gets into stronger drugs, and eventually they switch places, and I'm dealing with his addiction. He's lost in it, and it's tough. Every once in a while we get a glimpse of our loved one, but lots of times we're dealing with the addiction and not our child.
And I think that's one of the directions that the industry has gone in that I think is super important, is instead of blaming the family as part of the problem, and let's just remove you from the situation and kind of like fix you up and then send you back to the same place. It's inviting the families in from day one for education, for the therapy, teaching them what to expect, because, a lot of families have themselves unrealistic expectations. Well, if insurance is only going to keep you for 28 days, I guess you'll go in there, get fixed, and 28 days later, you'll come back and you'll be fine.
Yeah.
And that's not obviously how it works. And I think in the past, there's been a poor job of trying to include families as part of the process, especially if the person is returning to home after treatment, right? So why would you want to
Absolutely.
have the family involved?
Well, and that's a great point, because when my son, he was in and out of treatment, and I didn't get educated. When I got educated, it's when things started to shift, And I've started to mind my own business. I stopped trying to micromanage his addiction. I stopped working harder at his recovery than he was. And I started working a recovery program for me for my unhealthy helping.
And you never would have known that.
No, I learned the hard way. I got a lot of kicks in the stomach and a lot of it's self-taught, and learning to change language. And it was a hard, lonely road. But the other thing that happens too is the relationships, whether it's with the family or, dating or whatever, become toxic. Right. And
As a consequence of the use.
they're looking for love in all the wrong places, right? It all starts with self-love. So they're looking for someone to love them enough, and no one will ever love them enough because they don't love themselves. So therefore, the relationships often become toxic.
Right. I think it's both and, they're seeking out, instead of being picky about who they seek out, they may just accept love from the first person who offers it.
Right.
Right. And so you're setting the stage for a relationship that may be toxic. And then when you add drugs and other substances to it, we know that increases violence, irritability, mental instability, all of those kinds of things. So you cannot have a logical conversation, between two people who are both under the influence of something.
Right. Well, then the lying can become elevated, the gaslighting can become elevated. All of that stuff creates an elevated toxic relationship.
Absolutely. And so you have an additional problem on top of that, because when you go away to treatment, you may have to redo everything. Meaning there's a reason why they say people, places, and things. You may have to cut off life as you know it to restart brand new. And some people, maybe you can cut off. Easier said than done. Maybe your parents, not so much. Maybe they're good people who just didn't know any better. Maybe the parents are part of the problem too. We don't know.
Right. Yeah. Oh, I can tell you, I am very open and honest that I was part of the problem, because every time he would come home, I would remind him of everything he did wrong. Because what happens is that as the family typically is so hyper focused on what they're doing wrong, we don't see anything that they're doing right. And that's the thing I try when I work with parents and try to explain to them, look for something good. Because if somebody was constantly nagging at me and telling me I'm this or I'm that, or, just at me, I'm going to shut down, and I'm either going to withdraw, or you might get more of it. I don't know. I'm a withdrawer, so I'll withdraw. But I just think when we realize we're part of the problem, and that's a big step for families, because they don't easily see that piece.
And one of the ways that I try to describe it to families so that they don't feel judged is I talk about it in terms of just dynamics that have been established, right? Kind of like physics. An object in motion stays in motion kind of thing. So if you've always behaved this way, and as a result, I've always responded this way, we're going to continue to do the same dance over and over. But if you come into the room and you say something different to me than what you normally say when you come into the room, I'm going to pause, because I don't know what to do now. You've changed the rules of the game. You've changed the dynamic. And now we have an interaction that's more conscious, because now we're thinking it through. It's not just that rote, well, mom said this, so then I told her to screw off, and then we had a fight, and then we blew up. Mom just comes into the room and says, hey, what's up? I'm concerned you don't look like you're feeling well. That changes the entire tone and changes the response right here. And now if you change that response, the entire interaction is going to go differently.
Right. And and not showing up to every fight we're invited to,
Exactly.
because we're invited to a lot of them.
A lot of them. It's so much easier to justify the behavior when mom is a jerk, dad is a jerk, sister is a jerk.
Yeah. Well, that can be the excuse why you need to go, self-medicate. What are some steps that you would recommend to people that are in early recovery or seeking, well, let's say seeking treatment. And I think it's tougher when somebody's married. You just can't move away from the relationship. And I think when somebody comes home from treatment, you might have to get to re-know each other, and especially if you are always drinking together. So, and then the spouse, if they don't understand it, they feel neglected, they have resentments. Yet again, here you go again. Now you're off to AA meetings or NA meetings, or, what about me? Can you talk a little bit about that type of interaction?
There's so much to that,
Yeah.
right? Just the entire relationship. The relationship that you knew is dead.
Mm,
It can't survive,
yeah.
right? Because hopefully you're going to go into treatment, make some changes in yourself, which when you come home, again, is going to change that dynamic between the two of you. It cannot survive. If you and that's okay. It's not supposed to survive if you're doing the work the way that you should be doing it while you're in treatment. And that's why I always say to the family members, while your loved one is in treatment, you go get your work done too,
Yeah.
right? Because somehow you two are propping things up. And the number one thing I will always tell family members, listen, don't give an ultimatum unless you are prepared to follow through on it. That is the worst because that will shoot your credibility right into the toilet.
Yeah, we have a tendency to move the finish line. And
Right.
and and what it teaches them, and I didn't learn this till I was much older, we teach people how to treat us.
Mhm.
And when we remove their finish line and we get mad at them because they didn't complete or the agreement, then we're angry, and here we go again, being toxic to each other.
Right. Right. And listen, I like to use limits and boundaries. Does it come off sometimes as an ultimatum? Maybe, but I think with limits and boundaries, there's some flexibility. And there really is an opportunity for the couple together to sit down and work it through and set those limits and boundaries together. I
Yeah.
think it's part of establishing a new kind of relationship, not just one person saying, if you do this, you're out or I'm out or whatever. That's a dictatorship, not a partnership. And if you want to create a new relationship where the two of you are working through things together, that means deciding together what the limits and boundaries are.
But I call it a living agreement that that typically with the parents, especially if the teen or adult child is living with them, it's much easier to incorporate, but it can work for partners, spouses, because it's a three strikes you're out. It it
Right.
it tells, if this happens, this is what the consequence is gonna be. Number one, always give a good and a not so. So you go to treatment, or I'll take the bedroom door off, and you lose your privacy. And then the second one might be, I'll put your door on, you get to sleep in the living room, or go to treatment. And then the third one would be, I'm gonna take you to the local homeless shelter or go to treatment. In the end, because they make the choice, and they can't blame us for the choice they made.
Right. And that's the same thing that we talk about as parents that they tell us to do with our kids when our kids are really young. You don't want to be racing around the kitchen making 4 different dinners for everybody. So it's, do you want chicken nuggets or mac and cheese?
Yeah.
Right. Make it very easy
Yeah.
and specific. The more specific you are, the better off it is. Because one of the best things that I've seen is people with addictions are great at trying to find like the loophole. So keep it as simple as possible. Like you said, sleep on the couch or, I take you to the homeless shelter. Whatever the choice happens to be, don't fancy it up too much. It's not going to work. Make it as simple as possible. And also just preparing families for this when their loved ones are in treatment. Like, okay, this is just the beginning of the journey. Yes, there's a little bit of a sigh of relief, like, okay, I know my loved one is safe right now, but this is just the start of the recovery process, not the end.
Yeah, I teach a class on the cycle of recovery, and it's a 10+ year process, and people don't understand it. And talking, when I was running my in-person family support groups, talking to about post-acute withdrawal syndrome, because they would come to me and say, my child or my spouse or whatever has been in recovery for 9 months, 10 months, and sometimes it don't make sense when we're having a conversation. And so we have a conversation about pause, the brain healing and how it takes time, and give them this amount of time, and then things will hopefully change. But sometimes that can be confused as a person has had a reoccurrence. Often the behaviors are similar, even though they haven't.
Right. Exactly. Exactly. And that's another way that I think the field has really developed over the past 20, 30 years is really recognizing the genetic piece, the biological piece, the neuro piece, all of those things in that play a part in addiction and eating disorders. It's not just a lack of will,
Mhm.
right? That if you just tried hard enough, you'd be able to not drink.
Yeah. Yeah, it's amazing. My son, he's been in recovery for 16 and a half years, and to see the difference of when we were living in it and now I work in the field, and seeing the positive changes that have happened, and that, people are getting better and there's an understanding. I did an article on the generation of addiction. And so, the like my grandparents' generation and my parents, I guess, was everything's a secret. Like, don't talk about anything. And then you get to the baby boomers, and we were a little bit more open, but you get down to the younger generations, they're very open about their mental health, about accepting people who have mental health issues. It's really interesting to watch. They don't have that judgment that.
No, it's kind of like, yeah, I'm an alcoholic and I'm a gymnast and I'm a good student and I sing. Versus in the past, it was, God, don't tell anyone. And that was it. Like
Yeah.
that subsumed your entire identity. And I
Yeah.
even think back in the days, God, this is a long time ago, but I remember maybe when I was little, you couldn't even say the word cancer. You had to say the C word. So can you imagine talking about alcoholism or drug addiction or any of those other things? Forget it. You couldn't even say cancer.
Right. Same with AIDS.
Right?
And that became prevalent. Keep it a secret.
Mm-hmm.
We're sick as our secret.
Mm-hmm.
That's for
Exactly.
sure. I kept mine for a long time. So, how did you get to this into the field, working with people who have addictions? And I did notice, like, you have a podcast, something about, I forget the name of it. I'm sorry.
It's called Slightly
Yeah.
Sane.
What's it?
Slightly Sane?
Slightly sane. Let's talk about that.
Mhm. So the podcast is a lot of fun. So that's something that I've always wanted to do. I've always been a media person. I did acting in school, public speaking. So those are the things that are kind of like my sweet spot. And I knew I really wanted to do a podcast. I wasn't exactly sure the direction that I was going to go, but I was working with, a coworker at the time, and we just started chatting, and we were talking about mental health issues and things that we see in the public, what's in the newspapers and how people understand their certain things. And we would just like make each other laugh at some of the things that we see that are going on in the world. And we just kind of said this would make sort of an interesting kind of podcast,
Yeah.
taking some pop culture, doing some education about psychology and mental health, adding some laughter, giving people some advice on how to cope with what we talked about, and kind of package it all up, give people what they need to just make it through another week until our next session. And that's what we started doing. So we've done, I think we're up to maybe close to 40 episodes now,
Nice.
and it's been an adventure. I love thinking of new ways to explain mental health issues to people in a way that is entertaining and relatable. And
Mm.
we can all come across some sort of thing that we've done in our life where if we look at it, it's like, why the heck did I do that? Right?
All right.
Right. So, and really just trying to understand, like we did an episode a few months ago about like America's obsession, particularly women, by the way, with serial killers. How true crime is huge in the female population, especially
Really?
college age women love watching all of those true crime shows and listening to the podcasts about serial killers. Believe it or not,
Wow.
fascinating kind of stuff. And so I
Yeah.
dug into a little bit of the research. Some of it is, that age old thing. Oh, I can change him. If I was only in his life, I could change him. And some of it is this kind of looking at if I understand why they do what they do, I can prevent myself from being a victim.
Mm.
And I thought that was really an interesting take.
Wow.
And it gives us a little bit of a sense of control in a world that is out of control.
Yeah, right. Wow.
Right.
Amazing.
Mhm.
I have no words.
So it's interesting the stuff that I find out that I'm like, wow, that is just fascinating how things work. And way more women are going into the criminal justice field than I've ever seen before.
Interesting. Huh?
Well, listen, if you look at the huge stories that are out there right now, we did an episode a couple weeks ago about Diddy, right? I mean, can a woman, and this is a bigger issue than this, can someone go somewhere and really feel safe?
Right. Yeah.
I, I don't know. Not maybe in today's world, or maybe we were just naive when we were younger and thought that stuff wasn't out there and it was.
Yeah. And I wonder, are we more aware because it's everywhere? It's all over the news, social media. Although, I don't know, I grew up in the 60s and 70s, and there was a lot of innocence, I think. Even you look back at like the acting, the old shows, and you look at the difference in the acting and the language and how people are treated. It's quite different.
Right.
So I do think some of it's generations. So you've written a couple of books. If you want to talk about those.
Sure. So those are kind of some fun things. I've always been interested in the writing piece. Again, like the media is kind of my thing. And there's all different ways to communicate a message and to get things out to people who need to hear it. Right. And not everybody can afford traditional one-on-one insurance. The healthcare system is not set up that way, or there's a waiting list, or you live in a rural area where you can't find someone near you. So, my goal has been to be able to find as many different ways as possible to touch people and to let them know that there's at least somebody out there who is thinking about how to get the message out. So that's through podcasting, through YouTube, through social media, through books. My first book was part of a series, and this was Total Wellness for Mommies. And that was around the time where I was having my kids too. And so it was very relevant to me to figure out what are the ways that I can keep myself grounded physically, emotionally, spiritually, so I can be present for my 3 kids. So better than others, but the information is kind of out there and it's very, very difficult. The next book that I wrote was really more of an intuitive, insightful, motivational kind of book, which really came from some of my intuitive kind of work of just trying to inspire people and get them to do the next right thing. Think about things before you act on them. Look around you. There's information all around you of maybe the next direction to go in. Do you have to do things logically? No. Listening to your gut can actually be the best data that you ever get. And really teaching people how to look inward a little bit and listen to what their own voice is telling them, because you'll never go wrong with that. And I'm proof of that. I made so many mistakes when I ignored what was going on inside of me.
Yeah, me too. So that must be your book, Wisdom from the Universe.
From the Universe, right? And that's a journal book. So that's really set up for somebody who really wants to do some work. There's sort of like an inspirational quote or thought of the day. And then on the other page is a page for you to reflect on it. Have I done that? Or is that something for me to think about? Or I'd love to get it into schools because when I tested it with little kids,
Yeah.
they loved it.
Really?
Yeah, which I was kind of surprised about. But again, people are open to everything and kids are more open. You want to get them when they're young because they're willing to talk about their feelings when they're that young before they learn, ooh, I'm not supposed to tell people I'm scared or I'm sad or I'm upset.
Right, before they've been programmed. So
Well,
where do people get your books?
I believe Total Wellness for Mommies is still on Amazon. Everybody can reach out to me if they want a copy of Wisdom from the Universe. I still have some copies of that one. I think I'm going to do a version 2 and put that one out or republish it. So when I give my information later, people can reach out to me directly for the book.
Awesome.
Yeah.
So what led you to do these books?
I mean, I like a challenge. If something comes my way and the universe seems to say this is a good opportunity for you, I'll likely take it. That's where I've done a lot of things where it's like, oh, I'm not quite sure how this is going to go, but I'm going to do it and see what happens. I've talked about in my podcast and in other interviews, I was raised in a fear-based household. Love my parents. They know that they are fear-based. They know that like everything is, oh my God, don't do that. What if? So the way that I grew up was you either are going to be the same as your parents or you're going to go against it. And I just decided to do the opposite of everything. So if there's something out there that's scary, I will do it as long as it's safe. I don't skydive, I don't cliff dive or anything like that, but I'm more of a risk taker than not. And so these seem to be great challenges. And I figured, let's see what happens with it.
Do you use any of those challenges or your books? Do you incorporate that when you work with people who are in active addiction or working on a recovery program?
Absolutely. So one of the things that I love to do when I'm running groups, a lot of times when you're in the addiction facilities, you have to be very careful that the groups don't turn into just a complaining session.
Right.
I'm uncomfortable. My wife did this to me. This person did this to me. It becomes very external. And to be able to really have some long-term sustainable recovery, you really need to get internal. You got to look at your own stuff. And what I found is starting a group using one of the quotes in the book gets people looking internally. Are they going to find like the solution to their life? Probably not. Is it going to get them from focusing on all of the bad things people are doing to them and get them focusing on themselves? Absolutely. And that's the first step.
Nice. So as we wrap up, any words of wisdom that you'd like to share with the listeners?
No matter how bad you think it is, you have an opportunity to start your day at any moment by just stopping. Just stop. And I don't like this word, pivot, turn, whatever word you want to say, go in a different direction. But if you pause at a moment and just think, what do I want my next step to be? Change it around in an instant. And that could be as simple as I'm putting down the cigarette right now. I'm going outside for a walk. It's lunchtime. I'm going outside instead of scrolling on social media. There's always an opportunity, no matter how small it is, to put those little blocks together. If you put little Legos together, eventually you're going to get something big out of it. And so, my goal is always to tell people, don't give up. Don't wait till tomorrow. Don't wait till New Year's. You can do something right this very second.
So true. And I love your analogy because I watch my grandson with these tiny little Legos, and they end up making this big, beautiful piece of art. And that he's challenged, but he works through it and gets through it, and that's life.
That's life.
To do it.
Brick by brick.
Yeah. So how do people get in touch with you?
So you can reach out to me on my website, www.lauraellick.com. Feel free to reach out to me also at my email address, lacwm93@verizon.net, and on all my socials, which it should be Laura Ellick Real, REAL. And I'm on TikTok, YouTube, Instagram, Facebook. It's fun. Catch my videos on there. I really try to be silly at times and bring some humor into what we talk about because life is too serious not to be funny.
Good for you. Awesome. Well, thank you so much. This has been a pleasure, and thank you for sharing all your wisdom.
Thank you so much. It's been a great conversation. I appreciate it.
Take care.
Thank you for tuning in. If you'd like to support the Sharing Without Shame podcast, please subscribe, like, and leave a review. If you're in need of emotional support, Donna offers private sessions. For more information about Donna and the services she offers, visit www.sharingwithoutshame.com or email her at Donna4support@comcast.net. Nothing in the Sharing Without Shame podcast is intended to establish a therapist-patient relationship or intended to replace the services of a trained therapist, doctor, or health professional, or substitute for professional mental health, medical advice, diagnosis, or treatment. Until next time, may your faith and strength heal your heart.